Dr. John Cole. I'm a pediatrician.
I'm Maggie Cook-Shamanik, and I am a public health physician.
My name is Melanie Underwick. I'm an infectious disease physician.
So I am going to reference the Centers for Disease Control and Prevention for their routine measles, mumps, rubella, or MMR recommendations. The first thing I want to say is that the MMR vaccine is highly effective, and it provides about 93% protection against measles after one dose and 97% protection against measles after two doses. So the CDC is a really good reference for this, and they recommend two doses of measles-containing vaccine routinely for children, starting with their first dose around 12 to 15 months of age, and a second dose at age 4 through 6, essentially before that child enters school. Children can get that second dose of measles earlier than 4 to 6 years of age, as long as it's 28 days after that first dose. So that pretty much covers the routine recommendations for children. For adults, they are considered up to date with their MMR vaccinations with either 1 or 2 doses, depending on certain risk factors, and we'll talk about those, unless they have presumptive evidence of immunity to measles, mumps, and rubella, which we'll also cover. So generally speaking, 1 dose of MMR is going to be sufficient for most adults. 2 doses are required, though, if they're considered at higher risk for measles. So these would be individuals that are in post-high school secondary educational institutions, if they're healthcare personnel, or if they're international travelers. So during measles outbreaks, health departments might provide additional recommendations to protect their communities. So they're going to look at the local epidemiology of the outbreak. So specifically, they might look at certain age groups that are being impacted by the outbreak. So in addition to the routine recommendations for MMR vaccine, health departments might recommend a second dose for adults, or they might recommend an earlier second dose for children 1 to 4 years of age who are residing in or visiting those affected areas with outbreak. So as long as that second dose is given 28 days after the first dose, that time frame can be moved up for that second dose between 1 to 4 years of age. If there's ongoing community-wide transmission that's also affecting young infants, health departments might recommend an early dose for those infants between 6 to 11 months of age. That one, they're going to take into account a couple of different factors. So this decision to vaccinate in this age group, again, 6 to 11 months, really depends on weighing the risks of potential long-term impact on lower immune responses when infants are vaccinated prior to that 12 months age frame, compared to the benefit of early protection when measles is circulating in the community. So there is some concern. The reason the routine recommendation for infants is that they're first vaccinated at 12 months is there is some theoretical concern about lower, longer-term immunity. So in order to address this, you're weighing those risks and benefits in the setting of an outbreak. Now, if an infant does receive a dose of MMR prior to 12 months of age, they are still going to receive a dose at 12 to 15 months and a dose at 4 to 6 years. So they will end up receiving a total of 3 doses of vaccine. And again, that's just to ensure longer term immunity for those infants that did get the earlier dose.
Very effective. The measles vaccine after the first dose provides 93% protection against measles. And after the second dose, the measles vaccine provides 97% protection against measles.
That's a great question, and I'm going to provide a resource here. I would recommend people reach out to their county or tribal public health departments to find a location that they can receive MMR. Also, CDC offers a site called vaccines.gov where you can go and put your zip code in and find pharmacies locally that are administering vaccine.
So the risks are very mild. Localized reaction would be the main risk that we see, and I would say that that's actually normal and expected. So that includes soreness at the site of injection, maybe some redness or swelling where the needle went into the muscle. Some children, a small percentage, will develop fever after a measles vaccine and MMR. However, just like any vaccine, the fever is not the child getting sick from anything in the vaccine. The fever is actually the body's immune response to the vaccine and developing those antibodies, which is how we have lifelong protection. So we just treat the fever with Tylenol or ibuprofen, and it usually goes away within 24 hours. Now, the most serious side effect would be an anaphylactic or an allergic reaction. However, this is extremely rare. And we've studied this quite a bit, and it's over 1 in a million risk of having anaphylaxis to any component of the measles vaccine or any other vaccine for that matter. So, to put that in perspective, it's much more likely to get struck by lightning than it is to have an anaphylactic or an allergic reaction to a vaccine. So these are very, very safe and strongly recommended by your pediatrician. And I just have to note one more thing. The measles vaccine does not cause autism. That's been out there for a while, since 1997, when a fraudulent paper came out by Andrew Wakefield. And that's been disproven over the last 25 years. So measles is not the measles vaccine, or any vaccine for that matter, is not associated with autism.
There are several groups of people that should not get a vaccine for the measles. Children under 6 months. After 6 months old, they can get an early shot. Usually it's between 12 and 15 months is their first shot, but you can get an earlier shot. Patients who have highly toxic chemotherapy should not get an active measles vaccine. Somebody who has HIV with a very low CD4 count, you don't give a live vaccine to those people. Pretty much everybody else is eligible for the vaccine, so long as you talk about the risks and benefits with your doctor, and they know all your chronic conditions, so they know if you're eligible. Oh, pregnant ladies, they can't have it either.
Immunocompromised people, such as those with immune system defects, or being treated for cancer on chemotherapy or steroids, should not be vaccinated with the measles vaccine. And that's primarily due to the fact that it's a weakened live virus, live attenuated virus. Pregnant mothers should also not be vaccinated during pregnancy because of the theoretical risk to the fetus due to the live attenuated vaccine, the MMR vaccine. And then if there's any allergy to any component of the vaccine, that would be also a contraindication to being vaccinated. The vaccine is not available for infants under the age of 6 months of age. So in that case, we would use something called measles immunoglobulin to help protect them if they're exposed. But the MMR vaccine is only for children greater than 6 months of age. On the routine schedule, we actually start at 1 year of age.
You can get your measles shot done earlier, as early as 6 months. However, your immune system at 6 months is not mature enough to form proper antibodies to last throughout a lifetime. So, if a baby got a shot at 6 months, they would still have to get 2 additional measles, mumps, rubella shots to get effective immunity for their life. People need 2 shots because the level of antibodies produced is greater with 2. The third shot isn't necessary because after 2 shots, you're about 97% protected from the measles. Not too much is 100% in medicine. So 2 shots is adequate to make the proper antibody response for people's immune system.
No, you cannot get the measles from the vaccine. It's a very weakened form of the virus that does not cause the disease, but it does stimulate an appropriate immune response in the body for lifelong protection. So that leads to antibodies against the measles virus. which will stay with that person for their entire life.
A live vaccine is an attenuated virus, which means it's a part of an actual virus from measles that they made in a laboratory that cannot become infective in a patient. So you can, after the measles, get a rash similar to the measles when you get your shot. Both of my children got these rashes after their shots, but it's not a form of active measles. You can't transmit the virus, even if you do have that rash after you get the shot. If you don't know if you've been vaccinated or not, I suggest you contact your primary care physician who have your vaccine records on hand. If that's not possible, then you can have your primary care physician check your antibodies called titers to the measles, which is run in a lab and can get done here at Community Medical Center in 1 day turnaround time. And that would be your most likely way to show that you do have immunity to the measles. People born before 1957 are assumed to have been exposed to the measles and are immune. So they don't necessarily need to get the antibodies checked. However, if you are not born before 1957 and you have a lot of medical conditions, you might want to double check at that point.
Generally, no. Since we know that if you have had 2 doses of the MMR vaccine, you are up to 97% protected. Uh, Generally, that's going to give you that lifelong protection you need. So an extra booster shot is not necessary or indicated in that case.